The murder of United Healthcare CEO Brian Thompson has revealed a simmering anger with the American healthcare system.
500,000 Americans declare bankruptcy every year due to unaffordable medical bills.
Americans spend more on healthcare than any other country. Over the last 5 years, government data shows spending on insurance premiums, hospital services and medicines have all increased. And yet, despite being the world's richest economy, millions of Americans still find it difficult to access adequate healthcare.
Denial of claims and all of these, financial impediments that you're describing that are put on customers is its own kind of violence, a different kind of violence.
I don't think it's hyperbole to say that these companies have acted with violence toward the people who are enrolled in their health plans, because they have, through delays and denials, have shortened the lives of a lot of Americans. The rate of denials has been increasing because of pressure from Wall Street. When you're trying to satisfy Wall Street's profit expectations, actually every 3 months, that means you have to take some actions that are going to result in people who are enrolled in your health plans not getting medically necessary care. They have one or two ways of controlling healthcare expenses. One is to reduce or control the unit cost of goods and services. Insurers over the years have done a lousy job of doing that. So they focus on reducing our utilization or making it more difficult for us to get the care that we need. And one of the reasons why you see an erosion of support for a fairer healthcare system, and one in which the government would play a more significant role in making sure that we're all covered, is because these companies spend enormous amounts of money on propaganda campaigns to scare people away from any kind of reforms that the industry doesn't like.
We as providers and patients every day are facing the challenge of the insurance companies controlling medicine. Not only do they control the delivery of care, they decide what it's worth. It's the only system I've ever heard of where the people paying the bill decide what the bill should be. And then on top of that, they decide a lot of times not to even allow the care that a doctor is requesting. They deny treatment, they deny studies, they deny everything, all the way up to the level of life-saving surgeries. But there's really no risk for the insurance carriers to deny treatment. There's no risk, there's no repercussion. And I think that's where the problem is. The glaring problem we have right now is the wrong people have control of medicine.